You wake up with a strange bite on your arm. Is it from a spider or is it the start of Lyme disease? So one can be an inconvenience and the other can change your life forever. And today I'm going to show you how to tell the difference and what to do next. I'm Dr. Jason West from the West Clinic, and for over 25 years, I've been helping people recover from chronic Lyme disease. And in this session, you're going to learn the visual and symptom differences between spider bites and Lyme disease, when to seek immediate care, and how to protect yourself and your family. And at the end, I'll answer your top questions and share my free Lyme survival guide. I'm the Lyme fighter, and I've seen countless patients who thought they had a spider bite only to find out weeks or even months later that they were dealing with Lyme disease. And that delay can be the difference between a short course of treatment and years of fighting chronic symptoms. And I wanted you to help avoid that mistake. So let's break it down. First, why do people confuse both? Well, both can cause redness, swelling, discomfort, and sometimes systemic symptoms like fatigue. So I have this graphic right here. When you have a red mark on your skin, the difference between a spider bite and tick can mean the difference literally from getting treatment right away, and it can be really, really deceptive. I wish that it was literally this easy right here, where we had a little divot that we could see and you could just see, hey, was a spider in there or a tick in there? But the timing, the pattern, the progression, they're all different. So let's talk about spider bites first. Now, most spider bites happen quickly. You often feel the bite or at least notice something within the first minutes or hours. There could be 2 small puncture marks and some swelling, and certain spiders like the black widow or the brown recluse can cause some more symptoms and muscle cramps, nausea, blistering, or even tissue breakdown. Now, if you look at this right here, immediate onset, physical signs with 2 small puncture marks, progression of symptoms, usually spider bites improve over several days and the bites don't spread to the body, and so you start thinking of the bad guys. With most common house spiders, symptoms usually improve. Lyme disease, on the other hand, starts with a tick bite, and ticks are sneaky. They inject this numbing agent in their saliva so you don't feel the bite at all. The early hallmark signs, though not everyone gets it, is that thing called erythema migrans, or the bullseye rash. Now, this rash typically appears 3 to 30 days after the bite, and it starts as a small red spot and slowly expands outward, sometimes with the central clearing. So good in the middle, and then you start to see the redness on the outside. Now, only about 70% of Lyme patients get this rash. That means that a significant number never see it. And that's why symptoms like fatigue, and fever, headaches, muscle aches are so important to recognize. And another key difference is progression. Spider bites generally don't spread to multiple parts of the body unless you have an allergic reaction or a rare venom-related complication. But Lyme disease, if that's untreated, it can spread through the bloodstream and affect the joints. It can spread through the bloodstream and affect the joints, the nerves, and even the heart. So here's the million-dollar question. What do you do if you're not sure? Now, first, document everything. Take a clear photo of the bite, note the date, and write down how it changes. Second, monitor your symptoms. If you start to feel achy or feverish or unusually tired, or you notice new neurologic symptoms like tingling, facial weakness, you should get checked immediately. And third, this is critical. If you have any suspicion that could be a tick bite, you get evaluated by a provider that's experienced in tick-borne illnesses. Now, I've done videos about the best types of testing, but some of them here, the traditional Lyme testing like ELISA and Western blot, they can miss cases, and especially early on. Now, at the West Clinic, we often use a more sensitive testing. We can use some conventional medical panels, a complete blood cell count, and a metabolic panel. Now, this does not tell you have Lyme. It tells us how is the body responding. Is there a fever? Is the white blood cell count go up? And then there are other factors looking at the neutrophil count and the lymphocyte count that help us to understand. Some of the best testing is the IGeneX panels, and my very favorite medical research project, it's live blood microscopy. Now, this allows us to look at your blood in real time and see if there are changes that suggest infection. So we take where you live, where you've been, the history, did you have a bullseye rash, all of your clinical symptoms, conventional testing to see is your immune system even responding. We'd love to look at the Western blot, the ELISA, or the IGeneX test. And when we put all of that together with some research, I feel we get a really good outcome of what's happening. Now, I've seen so many patients who came on months later thinking that their spider bite just never healed, only to find out that they had chronic Lyme disease. And sadly, by then, the bacteria has moved deeper into the system, and early intervention changes everything. So let me share you a story. A patient came in about 4 summers ago with a red spot on her ankle, and she'd been camping in the mountains and thought it was just a spider bite and waited it out. By the time that she came in and saw us, she was experiencing brain fog, knee pain. Okay, so when it comes to mystery bites, especially in tick country, it's far better to be safe than sorry. Now, if this has been helpful, I'd like to invite you to get my free Lyme survival guide at www.lymefighter.com. I packed it with strategies to protect yourself, recognize symptoms early, and know what steps to take if you suspect Lyme. And if you're dealing with ongoing symptoms that no one has been able to explain, I believe that we can help you. I'm Dr. Jason West. It's my mission to help people not just survive Lyme disease, but thrive. You don't have to do it alone. Let's get you on the right track before that bite becomes a bigger problem. Now, people ask me all the time. These are the frequently asked questions of 25 years of having people in the system. How can I tell if this spider bite or Lyme disease? So let's just go through some quick bullet by bullet. Spider bites usually appear quickly, within hours. You might even feel a sting or a sharp pain when it happens, and sometimes you'll even see small puncture marks. And this swelling usually peaks within a day or two and starts to improve. Now, Lyme disease from tick bite is different. You see ticks injected numbing agents, so you often don't feel the bite at all. A classic sign, 30% of the time it's not there, is the bullseye rash that appears days to weeks later. But here's the catch. Not everyone gets that bullseye rash. And you also want to watch for things like symptoms of flu, fever, fatigue, headaches, and these develop over days, not hours. Now, people ask, can a spider bite cause a bullseye rash? It's not in the classic Lyme pattern. Now, some spider bites cause redness, swelling, and even blistering, but they don't create that expanding ring with central clearing, and that's a strong indicator of Lyme disease. And another big question, what if I never saw a tick? Can I still have Lyme disease? Absolutely. Many people don't see the tick because they're small as a poppy seed, and you can get Lyme without ever remembering a bite, which is why symptom awareness is so important. Now, how soon should I get treatment if I think it's Lyme? The answer is immediately, right now, yesterday, last week. The earlier the Lyme is treated, the better your chances for full recovery. And so waiting gives the bacteria time to spread to your joints, your nerves, your organs. And even if you're not sure, it's better to get evaluated right away. And people sometimes wonder, can a spider bite make me feel sick like Lyme disease? And this is controversial, but I believe that. And usually it's only venomous spiders like the brown recluse or the black widow that make you really sick. And they can cause muscle aches, fatigue, and much less common is the local redness and swelling. Lyme disease is far more likely to give you a whole body symptoms, and it keeps getting worse. Should you get the bite tested? If you think it's a tick bite, if possible, save the tick in a sealed bag and get it tested. You can't test a spider bite directly. For Lyme disease, the blood tests are available, but the standard ones can miss early cases. And that's why I often recommend advanced testing like hygienics. And in our test, in our clinic, the medical research project on microscopy, we can look at the blood right away. What's the biggest danger in mixing them up? If you think Lyme rash is a spider bite, you may wait it out. That delay can give Lyme a head start and make it harder to treat and more likely to be a chronic problem. On the flip side, mistaking a venomous spider bite for something minor could mean missing the window or antivenom or appropriate wound care. So what you should do if you're unsure, take a clear photo of the bite and note the date. Watch how it changes in the size, the color, and the shape. Pay attention to symptoms like fatigue, fever, unusual joint pain, and get checked by a provider who knows both tick-borne illnesses and skin reactions. And when in doubt, you get evaluated. It's better to be overly cautious than to risk something, and that could change your health for years to come. Now, I'd love it if you would hit the like and subscribe button. Share this with someone that's fighting Lyme disease or has unexpected and untreatable conditions. We specialize in hard things. We've had 110 years of having people to beat their disease. We don't help everybody, but I'm always surprised when we can't improve some. If you want immediate help, go to lymefighter.com and get our guide. If you have to go really fast, call 208-232-3216 and ask for the patient care coordinator. I'm Dr. Jason West. You can see all of our other Lyme videos right up here about testing, about early intervention, and even about oil of oregano. We'll see you guys on the next video.